If you deal with persistent tightness in your neck, a constant ache in your lower back, or stiffness around your hips and the base of your skull, you are dealing with one of the most common physical complaints adults experience. The usual response is straightforward. You stretch the tight areas, you apply a heating pad in the evening, and when neither of those completely resolve it, you simply push through the discomfort to get through your day. Any relief you find is strictly temporary. By the time you wake up the next morning, the stiffness has returned, often exactly as rigid as it was before. The assumption driving this endless cycle of stretching and heating is that the muscle tissue itself is the source of the problem. Over time, ignoring the actual root of that tension creates a cascade of secondary issues. The stiffness leads to recurring headaches, disrupted sleep patterns, and a gradual, normalized loss of your overall range of motion. Addressing only the physical sensation of tension guarantees its return, because the body is actively choosing to maintain that tightness as a deliberate response to the state of the underlying structure. The source of that instruction lies deeper than the soft tissue. The issue typically begins with a spinal joint that has lost its normal mobility or become slightly misaligned. When the nervous system detects a restricted spinal joint, it sends a panic signal outward. The muscles receive that signal and forcefully contract, building a rigid casing to prevent further injury. This guarding response is a necessary biological defense mechanism. It becomes a clinical problem when the perceived threat persists and the signal fails to deactivate. Chronic tension is an active neurological defense mechanism. The nervous system is commanding the muscle to stay tight. Leaving that muscle guarding in place creates a mechanical consequence for the surrounding skeletal structure. This flowchart maps the cycle. A joint restriction triggers a nervous system alarm, causing muscle guarding. Over time, this tight muscle pulls the joint further out of alignment, triggering an even stronger panic signal that locks the cycle in place. This loop explains why standard home remedies fail. Stretching a muscle physically pulls on the tissue, but it does not deactivate the neurological alarm bell that is driving the contraction. Applying heat will temporarily increase blood flow and soften the tissue, but once the heat is removed, the joint restriction remains, restarting the protective pattern. Interventions targeting the soft tissue alone cannot stop the structural driver that is commanding the tension. Halting this mechanical loop requires a simultaneous two-pronged intervention to address both the bone and the muscle. The first intervention addresses the structural driver. Through targeted chiropractic adjustments, Dr. Jason Haycock and his team in Meridian, Idaho, focus on restoring motion to the restricted joint. Restoring movement to the joint changes the sensory input reaching the brain. As the restriction clears, the neurological signal driving that protective contraction decreases, removing the primary reason for the guarding reflex. However, even after the neurological command changes, the muscle tissue itself often remains a physical liability. Long-term bracing creates a memory in the tissue, leaving it physically tight and prone to pulling the joint back into restriction. That requires a second intervention, targeted deep tissue massage therapy, applied during the same appointment to manually work the braced tissue. This release of the soft tissue ensures the muscle does not fight the newly corrected alignment. Synchronizing the structural correction with a soft tissue release produces durable relief. By addressing both the joint restriction and the muscle memory at the same time, you break the cycle of chronic tension instead of merely masking the symptoms.